You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, getting rid of bleeding gums, bad breath, loose teeth, and how to save your existing teeth that you think you are in the process of maybe losing. We're talking about lasers in dentistry. With us today, we have an expert on the topic, and he is Chicago's periodontist, Dr. Haralampopoulos. Doctor, welcome to the program.
Glad to be here, Randy.
So before we get into today's topic, lasers in dentistry, as a periodontist, like who is your typical patient? Like what kind of conditions do you treat?
We really don't have a typical patient, and we treat multiple conditions. Sometimes people have receding gums, and we do techniques that actually could cover the root surface and improve their appearance and help salvage their teeth. Other patients come in with actually diseased gum tissue, and you could tell this by bleeding gums and loose teeth and bad smells in their mouth and bad taste in their mouth. And we do either laser periodontal surgery to improve these particular patients, or we do conventional periodontal surgery to treat these patients. We have other patients that come in with gummy smiles, and what we do for these patients, we delicately remove some of the tissue, expose more of the tooth, and help them look better and really fulfill a desire that they've had for many, many years.
Okay.
We also do mini implants. We also do conventional implants, and we do these for patients that want to restore missing teeth. Our practice is multifaceted, and there's not many things that we can't do.
Now you also, I guess, work with your daughter. She's a dentist.
Correct. She's been a dentist for about 10 years, and she works very closely with me in my office.
Okay, good. So today's topic, one of the reasons I invited you here to talk about lasers in dentistry, how are you using lasers in your practice?
We're using lasers to help patients that have periodontal disease, to eliminate the infection, try to help them keep their teeth. Additionally, I chose this one particular laser to help patients that have ailing implants, and we can use the laser to disinfect an implant surface and allow these patients to retain their implants with some techniques that could grow the bone back for these particular patients. We use lasers for biostimulation, which it provides energy to the tissues that help healing. We use it for photomodulation, where we can actually treat oral lesions with the laser. We also can use the laser to improve gummy smiles, to expose more tooth structure. A lot of patients have what we call passive eruption. What it means is their teeth didn't fully erupt, so we kind of help it along using the laser to expose more tooth structure. We also use the laser for sleep apnea, where we could stimulate the palate and get tightening of the tissues. We also use the laser to actually remove some wrinkles around the patient's face.
Is that right?
That's
okay, good.
Correct.
Okay, so gum disease. We're talking about getting rid of the bleeding gums, bad breath, loose teeth with the use of a laser. And I guess there's two ways to do it. You do both, but there are two ways to do it.
Correct.
First off, what is gum disease, right? And what are the current treatment options?
Gum disease is a bacterial infection that affects the gums and bones supporting the teeth. Bacteria collect onto the crown of the tooth, give off chemicals and toxins. Some go into the saliva, cause a bad taste in the mouth, bad breath. Some of these chemicals from the bacteria go into the tooth and cause decay, but some go into the gum and bone around the teeth. And what happens in these particular situations, the gums start bleeding, they become swollen, and over time the gums start loosening from the teeth, and they start losing the bone support around the particular teeth.
So this is how you lose teeth. I mean, is this the number one way you lose teeth?
It's the number one way of losing teeth, more so than decay or any other method. And usually patients aren't aware that they have a problem because it doesn't hurt them. It just kind of gets worse through the years without really them being aware of it. And unless a dentist brings it to their attention, and sometimes they wouldn't know they had a problem. And a lot of times the reason we get a lot of referrals from general dentists to help treat this particular problem.
So I guess the way you're treating gum disease is not the typical way they're treating gum disease, because you're using a laser. So to get rid of this bacterial infection, I guess there's like a couple of ways to do it. How is it normally done, and how are you doing it?
Well, normally it's done by cutting away the gum tissue. Other times it's involved with peeling back the gum tissue to expose the root surface and clean off the material that collects on the root surface, the tartar, the calculus, the bacteria.
Okay.
The laser is much simpler, where you don't really have to peel back the gum tissue. You don't have to expose the bone, and you actually could go into the existing pocket, and pocket is the loose gum around the tooth, and treat the tissue there with a potential of regeneration, growing bone back, and keeping the gum tissue at a higher level. The first the technique that involves the cutting away of the gum or the peeling back of the gum tissue.
That's how you were trained, right, as a periodontist?
That's how all periodontists were trained.
Okay.
And that particular technique disfigures a patient a little bit. They expose more tooth. And these days...
So you actually cut some of the bad gums out.
Right.
In the old way of doing it. I'm calling it the old way.
Yeah.
It's still being done today, but that's one way that's being done.
Absolutely. It's probably the more common way of being done.
Is cutting out a bacterial infection.
It's cutting out a bacterial infection. And we now have methods of destroying these bacteria using the power of a laser. And we have potential of removing some of the diseased tissue that lines the tooth surface by using a laser without even touching the tooth surface. The laser has ability, just like a microwave could heat your food, and it's invisible energy. The same thing with a laser. It's invisible energy, and it could just destroy certain tissues and not destroy.
So the laser
other
kind of
tissues.
disinfects the area.
It disinfects an area, but it also sterilizes and detoxifies the root surface. There's bacteria that collect on the root surface, and very often these bacteria are very hard to remove. We've tried using chemicals, we've tried using brushes, we try to use all kinds of things, but sometimes only the erbium laser can remove.
Can get way under there.
Get underneath
and zap these bad bugs. It's kind of like bad bugs under the gum line.
Absolutely, killing the bad bugs. The erbium laser kills lighter colored bacteria, and the ND laser actually destroys the pigmented bacteria. Both are present inside of periodontal pockets, and both need to be treated.
Let me ask you this question. So, first cousin of mine, he tells me I have to get 3 teeth removed. And he says, what do you think? I said, well, maybe get a second opinion. He went to a laser dentist who was a periodontist. And so she goes around the mouth in a laser, and now he doesn't have to remove those 3 teeth. So how is that even possible? Like what is the laser doing to help that out?
In this particular situation, the laser would be just removing the bacterial infection. It won't tighten these teeth, but there are methods of tightening these teeth by placing crowns on these teeth and supporting these teeth. So a lot of times you try to correct the supporting structures around the patient, and this opens possibilities for them to restore their teeth and restore their smile, be able to talk better, be able to eat better, be able to smile better, to improve their appearance, to feel better about themselves. There's many patients that really feel it's important to keep their teeth, and we try to accommodate them. There's sometimes these particular loose teeth have to be removed, and then we can replace them with implants and other techniques.
Okay, good. So with this laser, you have a video, and I saw the video, and we're going to show the video in just a moment. But I guess, like for people just tuning in, we're talking about getting rid of gum disease, this bacterial infection, some of the symptoms: loose teeth, bad gums, bleeding, puffy red gums. So you can either kind of go in there, cut the gums open, do a deep cleaning, or you can delicately go around in a laser to kill the bacterial infection.
Absolutely.
I'm not oversimplifying it too much, but that's how I'm understanding it.
Basically, that's what happens.
So we're going to take a look at this video, and it's showing what the laser does.
Yes. Well, it shows what the laser is removing.
Okay.
This particular video is showing, it shows exactly what we try to accomplish with the technique. We gently go into the pocket, the loose gum around the tooth.
The pocket is what? The gum surrounding the tooth.
Exactly. It's just like hair. You have the gum initially is attached tight to the root surface, but as you get gum disease, the gum becomes unattached as you lose bone, and you have this loose gum around the tooth. At this point, the laser comes in and cleans this inner lining, removes whatever diseased tissue is there, and also a different laser cleans the root surface. And
the gums kind of hug the tooth again?
Well, yeah, exactly. That's what we want as an end result. But initially, we also try to get a little bleeding in that particular area, because the blood has the growth factors that are important for regeneration to occur. So after we clean the gum part of the pocket, and after we clean the root part of the pocket. You actually have connective tissue in one form and connective tissue in another form on that particular tooth. And with the bleeding gum in between it, you kind of press the tissue together. And when you have it pressed together, it has a chance to regenerate and reattach to the tooth and actually keep the position where it initially was, instead of the other techniques, they may reposition the gum tissue a little lower.
Okay, which was more of the cutting
That was more
method.
that was more the cutting method, and
So the laser treats it more like a bacterial infection, which is what it is.
it treats a bacterial infection, and it doesn't compromise the patient's aesthetics.
Okay, because compromised aesthetics meaning you don't have to cut the gums.
Yeah, the patients end up looking better because you don't have to cut the gums.
Okay, let's go to the video.
The ND-YAG laser is used to remove the diseased epithelial lining to within 1 millimeter of the bottom of the pocket. While the diseased epithelial lining is being removed, the ND-YAG laser energy also accomplishes biostimulation, which has been shown to increase the body's healing response by 6 times. Removal of the diseased epithelial lining with ND-YAG laser energy. Next, we insert a specialized erbium-YAG handpiece tip with water spray into the pocket to remove calculus. With the laser firing, the tip is lowered along the root surface towards the bottom of the pocket. Thorough removal of the calculus is crucial to good healing results. If any calculus is remaining, the erbium-YAG laser is used to remove it. The erbium-YAG laser is then used to dissect the periodontal attachment from the bottom of the pocket to the bone. This is necessary to stimulate the regenerative factors from the bone that will help with healing in the periodontal defect. Wavelength optimized periodontal therapy, a breakthrough in minimally invasive periodontal disease treatment that can restore your patient's periodontal health.
Okay, good. So is that pretty much what's happening then?
Yes. And this is I have to also tell you, the healing is so much faster. The patient happiness of not suffering is so much better as compared to the older techniques that involve cutting. And
So is this true, like with the older techniques to get rid of the bleeding gums, bad breath, loose teeth, that you would do like one side of their mouth and it was so painful and so much downtime that you couldn't even get people to come in to do the other side of their mouth? Is that true in some cases?
In some cases, that is true. But with these minimally invasive technique.
With the lasers.
With the laser, right. When I say minimally invasive, I mean you don't do any cutting. And with these particular type of techniques, the healing is much better, and results actually are more pleasing at the end with less discomfort.
Okay, so when I looked at that video, it reminded me of like barnacles on the bottom of a boat, right? And it seemed like they were being cleaned off. So underneath the gum line, you get like a...
Yeah, it's just like taking...
Like a bumpy surface?
Yeah, it's just like you say, you take a buoy in the ocean and you throw it into the water, and first some green stuff will start collecting on the buoy, and then afterwards the more crusty stuff collects on onto the buoy. Same thing happens to the teeth. The root is in the root lays in saliva, and initially you get a film collecting on the tooth surface plaque, and then this converts to new bacteria attached to this, and eventually you start getting this calcified material below the gum, and these are what you call the barnacles.
And that irritates the gums, and the gums start pushing away.
Physically, it irritates the gum, but
that's why the bleeding? Is that one of the reasons of bleeding?
It's one of the reasons of bleeding, but also the bacteria give off chemicals and toxins that destroy that inner lining of the gum tissue. If you were to take a slide, if you were to look at the gum tissue underneath, it's loaded with white blood cells. It's a defense mechanism for all these bacteria to kind of try to enter into the body.
So the laser just kills all that?
The bacteria kills the inner lining that's bad, kills all the bacteria, and improves the root surface.
And if you get people early enough, is it true you could save their teeth?
Oh, definitely.
Like if you got people at the early stages, maybe they just all of a sudden started getting bleeding gums.
Yeah.
That's an easy one for you.
Right. Yeah, sometimes if you get them at early stage, they won't even need laser treatment. But as time goes on, then they have to do something a little more involved. But laser treatment is not that involved either. And these particular patients respond very well to treatment.
Is this a high?
And even advanced cases where you think that teeth should be taken out, you'd be surprised what could really work out, what could really help these particular patients if you do the proper treatment for them.
I guess the second part of this is when you take care of their gum disease with the laser, they get a beautiful smile again.
Yeah.
Now, you're a periodontist. You probably think the teeth are the most important thing.
Yeah.
How important is the smile, in your opinion?
Well, I think the smile is real important. I mean, if you lost even one tooth, how would this patient feel about his appearance? How would he feel about his smile? How would he feel about how his self-esteem would be? Even if a person lost a front tooth, it would cause much sadness, I would say, for the particular patient. How would people view this particular patient?
Yeah, like they're poor.
Yeah.
You're missing a front tooth.
You're poor, like why can't you take care of it? And so trying to help a patient keep their teeth is significant and is important.
Now,
to periodontists. And of course, we only do part of the story. The part of the story is we make sure the supporting structures, the teeth, the bone and gum around the teeth are nice and healthy. Then we also get help from the general dentist. We get help from my daughter, Dr. Nicole. We to try to restore these patients to really a pleasing smile where they could talk better, eat better, go to restaurants with more confidence, socialize with their friends better, and smile and joke. You know, once you give
is that
people,
right? I mean, do you see that difference? Like after you clean up their teeth?
Yeah. Let me tell you something, Randy.
Okay.
When people feel they're missing something, it's holding them back. For example, if you have a hairline you don't like, or you have a large nose, or you don't like your ears, or maybe you don't have eyebrows. Anyway, it may not be.
So if you don't like something about yourself.
If you don't like something about yourself, it holds you back. Okay. And the same thing is about teeth. If people don't like their teeth, it holds them back. It doesn't give them the potential that they can, of what they could be. So if we restore these patients with teeth, they could go out with their friends, enjoy a lunch. They could smile more. They're happier. They feel better about themselves. They love themselves more. And by that, you actually transform these particular patients. So as a periodontist, if you at least give them the supporting structures underneath, then we could add whatever they need on top of it through the general dentist, through putting crowns on teeth. I mean, the cosmetic industry is $1 billion industry. Everyone wants to look good. So if someone has something holding them back, even though...
So if you don't like your smile, do something about it.
If you don't like your smile, do something about it, because something can be done about it. And if you think you're going to lose your teeth, come in earlier and try to save that gum and bone around your teeth. And
okay. Now, you've said before that when I interviewed you about dental implants, that 35 million people have an upper lower denture.
Correct. Correct.
So, other than an accident, those people all had gum disease that led to them losing their teeth.
Yeah, gum disease would be the most common method of losing.
So I'll put you on the spot here. Yeah. Do you think if you would have got those 35 million people early enough, treated them with a laser, of course, at-home care, things like that, do you think you could have saved
their
teeth?
Absolutely.
Like people wouldn't lose their teeth if they had the laser?
Yeah, I absolutely. I think dentists sometimes are too quick in pulling teeth. For whatever reason, maybe their experience isn't the same as mine as far as knowing what can be accomplished. I mean, I have patients where they were told they would lose their teeth, and 20 years later, they haven't lost one millimeter of bone.
So some of these people with really, really bad teeth, and we were talking about this off camera, and that was that people with bad teeth are discriminated. People think that they're poor, they're not educated, which for some people is not true at all. They could brush and floss every day, all day, maybe 3 times a day, and this gum disease is not going to go away unless treated properly.
Right.
Is that true?
Yeah. The one
you can't floss out a bacterial infection.
Yeah. It's a bacterial infection that lives below the gum tissue that you don't have access to. So they could brush all day, they could floss all day, they could rinse all day.
Do people do that, by the way?
And they do
like a big waste of their time?
Well,
it is a waste of their time if it doesn't work.
Yeah, no, absolutely. It is a waste of their time. But these bacteria, they're nothing fancy about these bacteria. If you just expose them to the air, the oxygen in the air could destroy these bacteria. But you don't have access to this area.
Because it's under the gum line.
Because it's under the gum line. So when we use a laser and we close this their little niche of survival, their little home of survival.
Okay.
There's no place for these bad bacteria, that we call the anaerobic bacteria, to live in. And that's the advantage of the laser, to be able to close up these pockets, to get rid of the bacteria that cause the infection, and allow patients to really retain their teeth, keep their teeth.
Another question I have. So with people, like you say, when they have really bad bleeding gums, bad breath, loose teeth, not only their gums, I guess their gums move away from the teeth because they're infected, right?
Correct.
Inflamed. But the bone underneath the tooth starts to go away too. Is that true?
Yeah, that's actually the definition of periodontitis.
So
they lose the bone from around their tooth as well as the gum getting looser too.
So the infection is eating away at the bone too?
Basically, the chemicals from the bacteria are eating away the bone. These particular bacteria, we keep on talking about the bone around the teeth, we keep on talking about loosening the gum around the teeth. They're really not so good for the rest of your body either. There have been studies correlated with people that have periodontal disease, with heart disease, with diabetes, with strokes. There are studies that Emory University did a study where it showed that people actually increased their longevity by taking care of the periodontal disease.
Because if you have bleeding in your mouth, right, any bacteria is going to go into your bloodstream.
Absolutely.
So when you stop that,
you
stop
improve your health.
that
Right.
part.
Yeah. There's also, by changing the microenvironment around the tooth, you actually eliminate, the body can kind of heal itself, and that's what really you were trying to accomplish with the laser. Since I studied histology and I have a strong love of histology as a periodontist, when I do this particular work, I don't only look at it from a large point of view, but I look at it from a microscopic point of view and see what we're doing to the cells that are in these particular areas.
Another question. So I know lasers, when I have dermatologists on my show, that they're using lasers and the lasers stimulate collagen growth. They stimulate the tissue. Same thing with this, like a dental laser? It stimulates, like makes the gums better that way, and the bone?
The bacteria are eliminated by the laser, and by using a certain laser, you can stimulate certain the powerhouses of cells to heal.
We brought a slide because you were talking about all this bacteria that lives in the mouth.
Correct.
And so what we're about to look at is on a typical patient or like a really severe patient? Because it looked like a lot of bad stuff.
Well, this particular slide could be any patient, and it's any patient that has pockets, because these particular
pockets meaning what? I don't know what
the
that
loose
is.
gum around the tooth once again. So
Okay.
when you have this loose gum around the tooth, these bacteria once again collect in this area.
Collect in there. So your idea is to go in there with a laser and just kill all the bad bugs. So what I'm about to look at, could this stuff be killed by the laser?
Absolutely. And
Really?
these particular bacteria are the ones that collect inside these pockets.
Let's take a look. Let's take a look.
So Randy, this could be any patient. I remove them from their mouth right in front of them. I show them their particular
So all
slide.
those things swimming around.
Yeah, these
You show them this slide of their own mouth.
Yeah, seconds after I remove it, I use a phase contrast microscope. Once again, my histology background, and I point out that you see these different bacteria there. You see some spirochetes. You see some rods, but you also see white blood cells are usually a sign that an infection is going on, and these white blood cells concentrate into this area to fight off these particular bacteria. You also see some weird protozoa like amoeba and trichomonas, but these are all...
So the laser, so you go in, you disinfect the area, then you can take another like saliva sample, look under the microscope, and this is gone.
Yeah, well, I would say...
most of it's gone?
No, it's all gone. You know what I mean? But you kind of made it too quick.
Okay. All right.
I mean, of course it's gone if I remove it, but I'm saying that when the patient comes back in the future, they don't have these particular
Is that
material.
right?
And I could take a sample of this, and this particular sample would not show the same thing as you see in the slide. You'll see occasional
so you can't
bacteria.
cut this stuff out.
You can't
like
cut
when I
this
look
out.
at all those bad bugs, just so I'm right here, because it seems, I don't want to, but in your specialty, they'll go in and kind of scrape out this stuff, cut out some of the gums, and
but you don't have to cut out the
but
gums.
it's microscopic bacteria. There's no way they could scrape or cut it out, right? Is that
absolutely.
true?
It's true. That's why you use the laser.
Let me ask you this though: is the future? Because as I'm listening to this, logically it makes sense to go around to kill all those bad bugs with the laser, right? Is the future? Who knows how long? We're just people that are somewhat healthy. Somebody would go around their mouth in the with the laser? Do you think that day will come too?
Well, I would hope so.
If that's how you lose teeth, like the hygienist will be going around your mouth with a laser
Well,
for prevention.
Yeah, for prevention, you actually can disinfect by going around, but that doesn't really work on a long-term basis. You have to actually get the gum to reattach.
So it's a special laser that you're using.
Special laser.
And a periodontist should be using the laser, in your opinion?
I think they should be. And every time you go to a hygienist, they're always cleaning out the stuff below the gum. So you're not really gaining anything unless you actually have the tissue reattach and eliminate the pockets.
So it's like an endless battle. These people with gum disease, okay, that they go in, these things grow onto the root surface of the teeth, and about every 3-6 months, they got to go get them scraped off.
Right.
All the time. It's like their whole life revolves around.
But you're not always effectively.
But you're not killing the bacterial infection.
Right. You're not eliminating their home, the niche.
So
with
you're
these
saying
bacteria.
just kill it with the laser, and it stays away for a long time?
I say kill with the laser, give it a chance to heal with the growth hormones in the blood, and let it reheal.
We're out of time. Great information. Okay, so lasers in dentistry. So no more bleeding gums, bad breath, loose teeth. Look for a periodontist with a laser. Does it cost more money to go to a periodontist over a general dentist that might have one of these lasers?
Well, the general dentist won't have this particular type of laser. And laser treatment is pretty much the same cost as really the old conventional treatment. You don't...
the cutting
and those techniques. It's just another way of doing it that's more kind and friendlier.
So you're a general dentist that watches this show, because you work with the general dentist. I know you want to make sure that that was clear, because you work with the general dentist. But if the gum disease is out of control, they could send you to do the laser at your practice, and then they go back to the general dentist for everything else.
Absolutely.
Okay.
And we usually alternate with the general dentist as far as maintaining the health of the patient's mouth. I'll kind of look at the gums and bone around the teeth. They'll take care of the decay and the teeth above the gum level.
Okay, good. I want to thank you for coming on the show.
Well, I thank you very much for being here.
We'll have to have you back. So if somebody wants more information, they go to your website. They can find out more there. Absolutely. You can't save the teeth. You could give them their teeth back with dental implants.
Absolutely.
You're all doing it right there under one roof.
We're doing everything under one roof, and we love helping patients. We love caring for patients. We like serving patients, and we try to give them what they really need.
Okay, good. Thanks for coming.
Customized treatment plans for every patient.
Okay, good. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.